This is an in-service to discuss to you about the hip precautions that you have to be aware of for patients that have a total hip arthroplasty or a hemiarthroplasty. These hip precautions are not applicable to anybody that's had an ORIF of their hip. They don't have to follow those precautions. Before you start working with those patients as well, too, you want to check their weight-bearing status. 95% of the time, it's going to be weight-bearing as tolerated, but just make sure there's not a special circumstance where the doctor has indicated a different weight-bearing status. There are 3 primary hip precautions that you need to follow. The first one is to avoid hip flexion more than 90 degrees. And by that I mean when you look here, this is a 90-degree angle at your hip. So you don't want to exceed it by bending forward, and then you also don't want to exceed it by either lifting your hip or sitting in something real low that will increase the flexion of the hip. The main thing that you have to worry about for a seat surface is either one of the chairs in the room that's too low. So if somebody's really tall, you want to opt to use the highest chair you can find, and then primarily the toilets in the rooms. Now usually the single rooms that they typically use, the elective joint replacements, are high enough, but the toilets in some of the other rooms are pretty low. So if you do notice that the toilet is too low, then you're going to want to get a bedside commode and either put it over top of the toilet or just use the bedside commode in the room to avoid the hip flexion. The second hip precaution is that you are not allowed to cross your legs or cross the midline of the body. When they're laying in bed, we'll go over this in a little bit too, you would need to keep a pillow or the abductor wedge that would come with the patient in between their legs to keep their legs apart. When they're sitting, they're not allowed to cross their legs at the ankles, at the knees, anything. So that knee has to stay on the same side of the body, cannot cross the midline. The last hip precaution is no bending, no twisting, and no reaching. So laying in bed, they can't reach over and twist and get something on the opposite side. When they're turning, you can't twist like that. Your whole body has to kind of move together. We're going to go over a few of the transfers and a few of the positioning techniques that we use to help move these patients whenever you're working with them. The first position is whenever the patient's laying in bed. I briefly went over this too. But you want to have their feet apart. And if they can't keep them apart and you're worried about it, use the pillow in between their legs. They usually, if they're post-surgical, they will come up with an abductor wedge, which is this thing. And this would stay in between their legs at all times. That would keep their legs apart, and that would prevent them from being able to cross their legs over the midline. Now, when you're actually working with them in the bed, to have to roll them, this is going to be very important, so that if you would have to put a bedpan underneath of them or do some hygiene, you need to either keep this abductor wedge in between their legs or keep a pillow in between their legs to prevent them from crossing the midline. And then whenever you're rolling them, if this is her bad hip, you're keeping this entire side of the body in line. You're going to do a log roll so that whenever she's rolling, you're using all this stuff to come over all at one time, and then this hip is staying up away from this leg, and you're keeping space in between the leg for it. You want to avoid having the patient roll this way first, because now you're twisting, so you want the shoulder and the hip and the leg to come together. If you're not sure and you're not capable of doing it by yourself, get the second person so that they can control the leg and then the other person can control the upper half of the body. Okay, now the other thing that we have to worry about is getting them up out of bed. But before we do that, if somebody is actually capable of doing a bridge, which isn't completely common, what you can have them do is bend their knees up, and then they can lift their buttocks up off of the bed, and then you can place the bedpan underneath of that. That's not going to happen too often, especially very initially after surgery, but the degree of flexion at the hip is not anywhere close to 90 degrees, so you're still very safe to do this. Okay. Now, when we're trying to get them up out of bed, again, you have to keep this hip in line. So my suggestion is you want to keep it in line with the same shoulder and avoid it moving anywhere out of that line. So if this, again, is her bad leg, I'm guiding this, and then I like to take her other hand, and then I pull up, but I'm keeping that leg straight in line. I'm not letting any twisting, rotation, or bending. As she starts coming up to the bed, I'll slowly start to lower that leg down a little bit too, to make sure that we do not exceed any hip flexion. Okay, the last two things we have to go over are how to stand up and then how to get them into the chair. Get my walker. So to stand up, if they're tall, you can always raise the bed up, because the higher the surface, the easier it is to be able to stand up. Okay? When they do stand up, what you want to make sure that they don't do is bend way forward like that, because then you're getting too much flexion in. But basically all you're going to do, if you're not sure, have a person on the other side, but they're going to lean forward a little bit, stand up, and then they should be fine. The other suggestion you can do is, go ahead and sit down. Before they stand up, you can take that leg and slide it slightly forward, and then that will eliminate the flexion in the hip too. Once they're up, your only goal is to get them from point A to point B, which would be to get them over to this chair, but you don't want them twisting like this. So as they're walking, their feet have to kind of come with them. And then you're going to get them squared up to the chair. Before they sit down, this bad leg has to go out in front of them. Then they can reach back for the chair and sit down softly. And then you're going to do just the opposite when you get them up. The same thing, like I said, the foot would be forward. They can push up from the chair. You can give them a boost as however much they need. You'll get them right back into bed. They're going to put the foot out in front of them, reach back, and then sit down softly. And then the same thing again when we're getting them in bed. I'm controlling this leg. If you need a second person, they're doing the top, but I'm keeping that leg straight down in line with the shoulder and the rest of the body. So if you do those techniques, you'll eliminate the possibility of popping the hip out of the socket, which is the whole goal of maintaining the hip precautions. There's going to be a couple of sheets to follow and a quiz to do afterwards, and hopefully that helps you. Thank you.